Okay, so we're going to talk about a couple labs that we order for patients from time to time. The first one is called the Spectracell lab. So this lab checks for a patient's micronutrient level, vitamins and minerals. There are a lot of different micronutrients that we check for. The cost of the lab is $190 if they use insurance. It is $390 if they do not use insurance. So that is the cost of the kit to me. So we have to make sure that if a patient is going to be using their insurance, they must include a copy of their insurance card when they get their blood draw done. So I fill this out, and then I will either take it to the front when they check out, or the patient will bring it to the front. And this requisition with the kit, which is found up here, along with one of the cards to the lab. Any lab test now is the only lab that will draw. They cannot go to Quest, they cannot go to LabCorp. They have to go to Any Lab Test Now. And a copy of their insurance card, front and back, goes with the kit. You give the kit to the patient, and the patient leaves with all of this. You could even put it inside the box, would be best, because then they have a copy of their insurance card with the requisition and the directions to the lab all inside the box. Then this one is our MRT or LEAP test. This is a food sensitivity test. It's very specific to inflammation. It's a wonderful test to run with patients. Sometimes I'm the one who does the follow-up with these patients. Sometimes one of the LEAP certified dietitians does the follow-up. Unlike this one, I always do the follow-up, and I need 45 minutes. This test takes a month to come back, so it's a little bit of a wait. And then when the test comes back, we follow up with a phone call, and then we schedule with the patient for 45 minutes for me to review this. This only takes 7 to 10 days to come in, but again, they have to go to Any Lab Test Now. It is the only lab that they can go to get their labs done. And the requisition, which I bring to the front, or which the patient brings to the front, along with the kit, which is found up here, along with the card from the lab, all goes together inside the box, and then the patient takes the box with them. So this one does not need insurance. If you are ever confused, include the insurance, but you don't have to have the insurance with this one. This one is $335 for just the kit, and then it costs an extra $350 for them to work with a dietitian over the next 5 to 6 weeks for them to do the results. But this one does not have to have the insurance with it. So again, each box is going to have the requisition, a card to the lab, to Any Lab Test Now, and the Spectracell test also has to have a copy of the insurance with it. That's everything.